Well, good evening. It's so wonderful to see you tonight. And I'm going to try to merge together the concepts of medicine and the spiritual awareness that we have, just to talk about the mind, body, and spirit. But yes, a beautiful group that I work with, Kelsey Bowl. I've been there for 20 years. I started when I was 5. Yes, and I have a wonderful practice, a mixture of patients, young and old, and I have actually up to 4 generations of patients in my practice at one time. The oldest patient that I took care of was 102, and he just recently passed. And we kept him alive for a long time, and he was asking for more. Of course, in the writings, I understand we might have a natural lifespan of up to 150. Medical science says we can go up to about 120 with our lungs right now, but of course our gut pollution and ozone, loss of ozone, and all the things we do to our body is probably going to be very few. What is the oldest person living? Do we know? Do we know? Has anybody heard? Somebody had a birthday that they celebrated, but at any rate, I think we have at least someone 110, if I'm not mistaken, an elderly lady that they feature. But at any rate, let's get into our health tips. So now I'm going to start out first with Dr. Brian. He says, whenever my patient gets depressed, I tell him, snap out of it. Nothing's wrong with you that couldn't be cured by a little time off. Oh, I get that all the time. Can you just take me off for the next 6 months, Dr. Baker? A few hours of daily exercise, plastic surgery, a new career, shock therapy, brain transplant, better chromosomes, and return of your youth, and some new friends. So cheer up. You know, I sometimes want to say something like that because people come in and they're asking for the cure. And, you know, sometimes as a physician, I have to say there's no cure. And that actually was very difficult in the beginning because as physicians, we were taught that you should heal. And then being in practice after a few years, I realized that A, I could not heal everything, and B, sometimes I didn't even know what it was. You know, I didn't even have a full description of what it was. But working with patients, they've taught me over the years. It's been wonderful. The hidden words of Baha'u'llah, of course, gives us counsel much different than what Dr. Brian had to say. O befriended stranger, the candle of thine heart is lighted by the hand of my power. Quench it not with the contrary winds of self. I'm going to stay there. Self. And passion. What are we talking about there? The things that we do, the things that sometimes are just our habits, but they're not the things that are good for us. We know it. Ice cream, ahang. We know it. A little bit too much to drink, you know. Whatever it is that you do there, the self and the passion, that, you know, contrary winds of self and passion. The healer of all thine ills is remembrance of me. Forget it not. Make my love thy treasure and cherish it even as thy very sight and life. So that's what Baha'u'llah has to say about healing and what we do to ourselves. And actually, that's the answer. We do it to ourselves. Many of these things we do to ourselves. And yes, there's genetics. There's all kinds of other things that goes into there. Shoghi Effendi also talks about what Baha'u'llah tells us. In the case of disease, we should pray, but at the same time refer to the competent physicians. Well, of course, I do want a job, y'all. So don't, you know, it's like pray, but tie your horse. In other words, pray, but make your appointment to come see me. Because if there's something going on and you need some treatment, you should see a competent physician. You can't just pray only. Obviously, there's some things you can pray away, but you must see also a physician and abide by their considerate decisions. Baha'u'llah urges us that we obtain any physical ailment, we should refer to the doctor and abide by his or her decision. You notice how I edited that. Let me leave Baha'u'llah, his decision. Physical and spiritual forces have been used to secure the speedy recovery of patients. No partial treatment is sufficient. So again, saying that we use the spiritual, but we also use the physical. So that's like, we pray, but we take our antibiotic. And many times that prayer, it's uplifting to our souls. It can help us feel better, but we need to have that antibiotic in order to treat the infection. The physiology of aging. All right, I got some bad news for y'all. You're getting old by the day. There's no way we can reverse it. Brain cells are dying. If you drink, they're dying even quicker. Aging, the skin is wrinkling. You're losing elasticity there. Organs are slowing down. Mateen, you're doing okay. And a few of you, the young folks, but the rest of us, most of us, we're doing quite a bit of aging. Each day, each year. So that's why I have no more birthdays. So I'm still 25. Genetic factors, those do go into it. Some of us have simply genes that we inherited, and it's nothing we can do about that. I tell patients, we wish we could pick the ones we want and leave off the ones we can't, but we cannot. Environmental factors. Well, if you have good access to healthcare and you take advantage of that, then you certainly can catch disease early and you can do something about that. So while you cannot do anything about aging, you cannot do anything about your parents or the people you're related to, even if you don't like them, you can do something about the environmental factors, which is get access to healthcare as quickly as you can and get your regular checkups. Keep me in business. Health and well-being. Anti-aging, oh, y'all heard about this, make you young. One pill, one bullet, reverse the effects of aging. Please understand that there is no way that we can turn back the hands of time. It's simply not true. And a lot of these products have a lot of hype behind them. They call themselves things like natural or herbal or vitamin. And they just get you to empty your pockets. You won't even pay your $10 copayment, but you'll go out there and you'll pay for something that's going to make you lose weight in 30 days for $90. You'll order it off the internet. I've seen you. I know you. Who's done it? Go on, raise your hand. So, in other words, it doesn't work. The FDA finally, thank God, started periodically testing these things randomly, because it was just so much out on the market and they're unregulated. So anybody can just put something out there and say natural, and especially on the internet. So they started looking at these things and actually found toxins in them, as well as traces of chemotherapy medicines. Chemotherapy, traces of medicines that they use for chemotherapy. And believe me, if you don't have cancer, you do not want to be taking a medicine that has chemotherapy qualities to it. All right, early detection. So here's where we can make some strides here. And by the way, if you have questions, please raise your hands. Please. But regular checkups, what is that? That's about a year. That's usually about a year. But if you're much, in the younger group, it may be every 2 or 3 years. For the kids, unfortunately, they bring them in there every year because they got to have those shots. But as you get older, basically in your 20s and above, you need to get in there about every year because you've got something going on that you need to have checked, whether it's just the breast exam or the pap smear. In the case of 40 and above, we start bringing you in there and mashing the breasts. I don't know what that's all about, but that's the way we have to do the mammogram. Actually, raise your hand if you've had a mammogram. Okay, excellent, excellent. I love it, I love it. Don't they mash you? A man must have invented this. I don't know why women have not gotten into this field. But anyway, they make a pancake out of your breast. Yeah, it's interesting. And then if that wasn't bad enough, then they put you up in stirrups and get, oh, wait a minute, we have children in here. So let me not get too graphic. But get that pap smear as well. That is a screen for cervical cancer. That's very important to do. Bone density, this is when you are postmenopausal for the most part, and we'll talk about that. But 65 and above for women, 70 and above for men. Guess what? Men are supposed to get bone mineral densities. Colon exam and hemocult. Most ridiculous thing you will ever want to go through in your life, but it saves lives. About 40% of my patients that go in for a colonoscopy are found to have some type of polyp, and about half of those are precancerous. And when they remove that, it never turns into a cancer. It's like removing a weed before it gets to going. So colonoscopy, hemocult. Hemocult means hidden blood in the stool, the blood that you don't see with your eye, but that we can see through a developer. You take little cards, you smear some stool on them, you put them in an envelope, and you mail them in. Can you imagine that? I stopped ordering that one, because people would simply not do it. So what I do to them is I put the finger in the rectum and get it. Again, too graphic, Ahang? Tell me. You tell me when I get too graphic, because I work in body parts, okay? So all kinds of orifices. All righty, so let's go back. Rectal and prostate exam. Oh, I get a chance to pick on the guys now. You should just want to be a fly on the wall when these guys have to get their rectal and prostate exam, but it's very important. It saves lives. I have a cousin who died at the age of 39 from colon cancer simply because he would not go in and get a rectal exam. Do not be a victim of this. Yes, it is an experience that, Mateen, you will have when you're 40, but 40 and above, you need a rectal exam. Mateen, I'm sorry, Mateen. You're the only one I know the name of besides Ahang. So anyway, it's not a good experience, but here's a women have smaller fingers. You might want to get a female. Cholesterol and glucose. I'm sorry, wait, move on. Okay, cholesterol and glucose, you must get that checked. Okay, you have the good and the bad. Cholesterol, you have the total cholesterol, and you have triglycerides. It's all very confusing. Good cholesterol should be above 40 for men, should be above 50 for women, and if it's above 60, then it means it subtracts one of your risk factors. Okay, so if you have high blood pressure, it subtracts that, it neutralizes it. If you have a HDL, high density lipoprotein of over 60. So that's a good thing. If you have a high density lipoprotein in the 30s, I want you to get an AED. You all know what that is? Automated external defibrillator. In other words, be ready at any point to have the heart attack. No. But my point is I'm exaggerating. But HDLs in the 30s are not good HDLs. And guess what you have to do to bring them up? Diet, exercise. And for some reason, I get all the excuses in the whole wide world for why we don't exercise regularly, including it gets hot. And I ask my patients, does it get hot every year? And they say yes. I said, so why haven't you figured that out? In the mall, you can go to the gym. If you go to the mall, the ladies don't take the purse. That's all I can say about that. But you got to exercise, regular exercise, at least 5 times a week, 30 minutes, get your heart rate up to 85% of maximum. That means that you work up a sweat. I have a lot of patients that tell me I'm active. And I say, well, did you get funky? And they said, no. I said, well, then you did not exercise enough. All right, vision, hearing, and dental. These are also things you should be doing. So prevention is not smoking, no alcohol. As Baha'is, we advocate no alcohol. This is one of the things that are in the teachings. If you do drink, as a woman, it should be 1 drink a day. As a man, it should be no more than 2 drinks a day. I have all kinds of answers to that. Some people don't think beer is alcohol. It's a very interesting thing. I say, how much do you drink? They say nothing. I say, well, what about beer? They say 6-pack a day. Anyway, very interesting thing about alcohol. But in moderation, if you drink, as a Baha'i, we advocate no alcohol, no opium, no drugs. It destroys the brain cells. It's not good for you. It really isn't. And if you think about, let's just take alcohol out of the world. Let's just take that one thing out of the world. How many lives would be saved? How many marriages would be saved? How many abusive, murderous things that have gone on over our time? How many people would have not had impaired judgment? How many car accidents would we have not had? Alcohol is not something to celebrate, in my opinion, and in the Baha'i faith. But, of course, it is legalized. It's a legalized drug, but you want to use it in moderation if you drink. Exercising, we just talked about that. Rest and relaxation. I get a lot of people who say, I'm tired. I say, how much you sleeping? They say, well, I'm not sleeping. Well, you got to sleep. Rest and relaxation. It's called sharpening the saw. How many of you know about sharpening the saw? None? Sharpening the saw. You've heard of it? I know. It's a Stephen Covey. It talks about basically if you're chopping a tree and you're working constantly, and then the other person was chopping a tree, I'm going to do she's. So she was chopping a tree and wouldn't stop, and the other one would chop the tree and go rest. And she was chopping, and wouldn't stop, and the other one would chop a little while and go rest. By the time the end of the day came, guess who had chopped more trees? The one that rested, because she sharpened the saw as she rested. That other one was dull. So that is what rest and relaxation is about. You must take time off. If you don't, you will find yourself thinking you're doing a lot and you're not. Proper nutrition, coping with stress, and having a positive outlook. All right, here's some recommendations that you really should look at. This applies to both men and women, okay? Basically, calcium 500 to 600 milligrams twice daily. If you are in the peri and post-menopausal stage, you really want to be doing about 500 twice a day. So that basically means if you're 40 and above, definitely 50 and above, you need to be taking 500 milligrams of calcium twice daily with food because it improves absorption and it helps to reduce osteoporosis. Vitamin D needs to be taken with that. Some recent studies have actually even said vitamin D can reduce the risk of cancer. But it needs to be taken in 1,000 to 2,000 units per day. We didn't really know that before, but you'd think I get a lot of sun in Florida. Well, ask your doctor to check your vitamin D. I bet you it's right about 20. It's supposed to be 32 or higher, and 50 and higher is better. So take your vitamin D. Risk factors such as hypertension, hypercholesterolemia, diabetes. If you're 50 and above, ask your doctor if baby aspirin is right for you. It is definitely not right for someone who has a bleeding ulcer or bleeding disorder, but 81 milligrams of aspirin daily may be right for you if you have those kinds of problems. Normal blood pressure, they have changed. Normal blood pressure is now less than 120, less than 80. So if you have a blood pressure of 120 over 80, you are pre-hypertensive. If you have a blood pressure of 120 over 80, you are pre-hypertensive. Okay? So you got to really work on that and watch that. So if you get to 139 over 89, you are still pre-hypertensive. If you hit 140 over 90, you are hypertensive. Most of your strokes occur with blood pressures in the 150s to 160s, not 202 or 220. Yes, ma'am.
So how do you lower your blood pressure?
Exercise and diet and lower your salt and get some better genes. Hopefully you don't inherit it. But exercise and diet, keeping your weight at the normal BMI, body mass index, and eating the right kinds of foods that are not full of salt, and exercise. So keep it moving. 5 fruits and vegetables is a balanced diet. I encourage all of you to go online and look at the .gov pyramid, food pyramid. It's excellent. They keep telling us how more and more grains need to be put into our diet, which actually, if you read the writings, especially Abdul Baha talks about those grains and those nuts. And it seems like science is finally catching up and telling us about that. Musculoskeletal problems. A lot of us have it. I can't reverse arthritis, but I can tell you if you're wearing high heel shoes like I am tonight, don't come in and tell me your feet hurt. Don't go to the foot doctor with high heel shoes on and say my feet hurt. Don't do that. Don't do that. Don't any of you do that, okay? That just doesn't make any sense. But you have to wear the proper kind of shoes in order to support your back, your hip, your knees. It all starts at the feet. It goes through the toes, you know, the hip bone connected to the knee bone, connected to the ankle bone. Okay, all right, you understand. So it's all one body. So what you do on your feet, I just wore these for you all, by the way. But what you do on your feet, you know, does affect you. While at home doing chores, guess what? We all go around barefooted or in socks or in slippers. The worst thing you can do. They have the least amount of support. Please, put tennis shoes on when you're at home working. Ahang, you do all the housework. Put some tennis shoes on, sweetie. Hormones and us. We used to think that hormones were great. Now, y'all tell me when I start putting people asleep. I was supposed to be looking for some. Am I putting anybody to sleep? Okay. I just want. Where's Bob? He told me if I was putting him to sleep, I was going too long. Okay, anyway, hormones in us. Estrogen therapy. We used to think estrogen therapy was our anti-aging for the women. And we thought menopausal was something that needed to be treated. But guess what? Menopausal is natural. There were a lot of women before us that went through it, you know. They just did it. They drank water, they fanned themselves, whatever. They did it. Now, if you are about to kill your husband, or murder someone at work, or if you are waking up so many times at night that you are sleep deprived, then hormone may be right for you for a short period of time, okay? Estrogen supplementation. But for the most part, what we have found is that estrogen supplementation, it is associated with an increased risk of breast cancer after you've been on it 5 years or more, and it is also associated with an increased risk of cardiovascular disease, heart, and stroke. And yes, women do have heart disease, and it's a very, it's difficult to diagnose because it does not present in the usual way. So be careful with estrogen. If you're on it, it doesn't mean it's a bad thing. It just means you want to limit the time that you're on it and get off it with it when you can. And you know, there are other things that can help, and talk to your doctor about that. Okay, testosterone. I know you guys want to stay strong, you know, and virile, and all those good things. Yes, men do have some sort of, you know, I don't know, male menopause or something. It starts dropping off. But you do not want to take testosterone if you do not have a testosterone deficiency. It accelerates atherosclerosis, which is hardening of the arteries, which leads to heart disease, okay? So while you might want to do that, it's not a good idea. But if you think you are suffering from some of these things, then, okay, not that one right there. But if you think you are suffering from some of these things, you actually can go into your doctor and ask them to check your testosterone level. It is one of those things that they can treat. All right, an apple a day keeps the doctor away. How simple is that? How profound is that? I'm not sure who came up with that saying, but whoever it was knew exactly what they were talking about. This tells us, excuse me, that, and I'm sorry guys, my throat here. You can do all the vitamins, herbals, anything you want to do, but the most potent nutrition comes in the form of a natural source. It is the atoms, it is the way in which it is made, it is the skin of the apple, it is the core, it is your substance. And in the Baha'i faith, it talks about when we are advanced as a society, we will go back to the basics. It is interesting. Advanced, but will become retro. We will find that the foods are indeed the best thing, an apple a day. So when patients ask me, should I take a multiple vitamin, I say, well, it's okay, but think about the pill and how much processing they have to go through to get all those little vitamins in that little pill. And I say, if you have a true deficiency, of course you need to treat that. So I don't want to imply that vitamins are not something that you should take, but you want to take them with your doctor's recommendation. But what I really tell them is grow a garden. Go grow a garden. Because if you can get the natural thing, that's what you want. Baha'u'llah's counsel is do not neglect medical treatment when it is necessary, but leave it off when the health has been restored. Treat disease through diet by preference. Refrain from the use of drugs if you don't need it. And if you find that what is required in a single herb, do not resort to compounded medicament. Did I say that right, baby? Thank you. Abstain from drugs when health is good, but administer them when necessary. Now let me tell you about that one. Please don't decide when you should stop your drugs. Talk to your doctor, okay? I know you may have your high blood pressure medicine, and I know you may be thinking, I'm feeling all right, and I can just stop it. But there's a thing called rebound hypertension that will actually give you a stroke from abruptly withdrawing from your high blood pressure medicine. Do not do that, please. But there are times that when you have taken your high blood pressure medicine and you have done your part, you have lost weight, you have exercised, you have reduced your salt, you have changed your diet, guess what? You'll go into your doctor and the doctor will say you no longer need this much medicine, or they may take you off of it. And let me tell you one other thing. When I see patients after they retire, guess what? Half the medicine. They need half the medicine, and some of them completely come off of it. So when patients ask me, can I get away from having to take a high blood pressure medicine? I say retire, move to Hawaii, and live off of the fruits. Yes, ma'am.
What did you say happens if someone went off abruptly from their high blood pressure?
You can get rebound hypertension. In other words, you can go up very quickly. So you don't want to do that. Generally, we taper you off of medication but if you're, and that is not everybody. I don't want to make that as a definitive statement for everybody, because there are some people that we will simply tell to stop their medication. But there are some medications that if you stop them abruptly, your blood pressure will automatically go up very high. And so you want to be tapered off of it. Yes?
Were you saying earlier that too much estrogen causes a violent reaction? Or what was the moral of the story about if you want to kill your husband or whatever?
She is listening. Thank you for that. Let me go back to that side. That is, you gotta, see, you all have to understand something. I am out the box, okay? That's why I can put up with all hang. What it is that when you have a deficiency in estrogen, and it also happens around PMS time. Remember when people didn't think there was premenstrual syndrome? I think a couple of women actually got off on some court cases based on PMS. Yeah, they didn't use a premenstrual syndrome. There's two things that we're talking about here. One is when you're about to start that period and you go through these estrogen surges up and down. And then the other that I was talking about here is actually when you start going into complete estrogen deficiency. That's when you start getting a lot of irregular periods. You get vaginal and urinary changes. You get hot flashes and night sweats. Here's where your problem starts to begin. Because if you sleep deprive someone long enough, you will actually induce a psychosis, okay? They've done studies. It's about 36 hours. No, not 36, 72, because I've stayed up for 36 hours. I didn't become psychotic. But anyway, about 3 days. 3 days. If you stop someone, okay, from sleeping for about 3 days, they can become psychotic. So when you as a woman are going through these estrogen deficiencies and you're getting a lot of night sweats and you're not sleeping very well, then it leads to emotional and cognitive changes, okay? And that's where you might want to kill your husband when he does something that really bugs you. So in other words, I'm joking, but the bottom line is there's a lot of mood swings. You guys know it. You guys know it when the wife is going through this. A lot of mood swings, a lot of emotional changes. The fan wants to be on, you know, the husband and the wife are fighting over the temperature. You know, this is what we're talking about right here, okay? You're welcome. Okay, so where were we? I think we were somewhere in here. Increasing lifespan, that's quality of life. Preventing disease, that's healthy aging. Early identification, treatment, and then improving our sense of well-being. Preventing disease, here are the leading causes of death. Heart disease, cancer, stroke. COPD means chronic obstructive pulmonary disease. That's emphysema, chronic bronchitis, generally comes from a person who is a smoker or has secondhand smoke. That is the biggest thing, but can also come from certain chemical exposures, asbestosis, certain chemical toxins that you may have inhaled. You can also get this particular disease. Pneumonia and influenza. Can I get you all to get your flu shot this year? If you are 50 and above, you should get a flu shot. You should get a flu shot if you just want to go on and get it because it's a good idea. And if you have diabetes or heart disease or any asthma or chronic disease, you should get a flu shot, okay? Pneumonia, there's also a vaccine to prevent pneumonia. Get the pneumonia shot. 65 and above, you should have it. And if you have any chronic disease, you should have it. Diabetes. Diabetes is a leading cause of death. Diabetes can be in so many ways controlled and reversed by diet. If we look at all of these, we can say that they can all be reduced if we go back to the basics that we were talking about before, which is right nutrition, rest, relaxation, spiritual, mind, body, soul, all connected, and doing the right things for ourselves. Heart disease prevention, if you smoke, you must stop. You must control the blood pressure. Remember, 120 over 80, under 120 over 80 is normal. But basically, your doctor may want to control you in the 120s or 80s. But if you're 140 and above, you are not controlling it. Control diabetes. Heart disease and diabetes often coexist. So you have to control that diabetes, control the cholesterol. I want to go right back to the cholesterol. We talked about HDL. HDL should be greater than 40 in men, greater than 50 in women, greater than 60. It actually helps you. HDL is the happy cholesterol. H, happy. Okay. L, lousy cholesterol. LDL. Okay, so that one you want under 130 if you have no risk. But if you have heart disease and diabetes, you want that under 100. Under 100. And even preferably as diabetes, you want it under 70. So if you are not there, talk to your doctor about it. Lose weight, regular exercise, consider aspirin. There again, aspirin can reduce the risk of heart attack and stroke by about 25 to 30%. If you have a strong family history of heart disease, sorry. You know, you just got to work harder at all the things I just talked about. That's all I can say. And if you need to get on medication, this is one of those where listen to your doctor if your cholesterol is running 272 and your LDL is running 160 and your HDL is 30, your heart attack waiting to happen. Cancer prevention, stop smoking. A lot of people know that cancer is associated, smoking is associated with lung cancer. A lot of people don't know it's associated with bladder cancer as well. If obese, lose weight, it's actually associated with breast cancer, obesity, something we're seeing growing in our society. And by the way, men can get breast cancer. It is just very, it's not as common. High fiber diet reduces colon cancer. Go right back to the writings talking about the fruits and the grains and the fiber in our diet. This is where you can prevent colon cancer. Human papillomavirus, I want all the young ladies to listen up. Human papillomavirus, we now have a vaccine, prevents cervical cancer. It is recommended for girls 9 to 26. Cervical cancer is considered a sexually transmitted disease. I know everybody's looking at me like, what? It is. It's a sexually transmitted disease. However, there are other ways in which we can get exposed to human papillomavirus, and even if you are not sexually active, you actually want to get this vaccine before you ever are, because it can help prevent cancer. So, cervical cancer, a lot of people don't understand that. It is actually sexually transmitted, okay? It comes from multiple partners, it comes from exposure to HPV, it comes from multiple STDs. So this is something that you want to be very careful about, obviously. Sunscreen, that's another thing preventing cancer. You don't think about sunscreen when you're driving, but you're in the sun. So using an SPF of 15 or above, some people want to go up to 30 and 45, and that's okay too, but it at least has to be 15.
More people don't really understand that they're overweight.
Aha, they're big bone. Yeah, those are the big bone people. They tell me I'm big bone. I'm big bone, and my family's been big. Yeah, overweight is, okay, first of all, BMI that's ideal is 24. And if you are 27 to 30 in a BMI, body mass index, and you can get your doctor to tell you that, you are overweight. If you are 35 and above, you are obese. Okay, obesity is a medical term. It's not an insult. It means that you are probably over 30 pounds to 40 pounds over your weight. Okay, so obesity. But yeah, 35 and above is obesity. Overweight is 27 to 30. And then in there, in the middle of that, you're kind of pre-obese. So it's something in that regard. Okay, stroke prevention, it's the same thing as heart prevention, basically. Stroke and heart is the same thing. And we said LDL under 130, we said total cholesterol under 200, we said HDL over 40 for men, over 50 for women. That's what you want. And if you have diabetes, you want to control your blood sugars under 110 fasting and under 180, no matter if you just ate a meal, your blood sugar should not be over 180 if you are diabetic, okay? Don't smoke, pneumonia vaccine, flu shot. We don't have the swine flu shot available yet, but it is being researched, and hopefully we will have that this season, but we do not have it quite yet. But we do have flu shot with multiple other strains. Diabetes prevention, we really have already said this. Osteoporosis, not a leading cause of death, but significant disability. So please, women, take your calcium. We talked about that. Calcium, vitamin D, regular weight-bearing exercise, such as walking or weights. Don't smoke. It does definitely hasten the onset of osteoporosis. There are medications that can help you, and again, bone density, do that when you are between 65 and 70. Let's keep going. Yeah, patients get a kick out of it. Early detection of disease, again, here we go. Colon cancer, breast cancer, cervical cancer, prostate. That's the colon exam, that's the breast exam by both the doctor and the mammogram. I can't tell you how many times I get patients who said, I had my mammogram, so I'm finished. And I say, no, you must have the clinical breast exam, which is by the physician, to make sure that you still don't have any lumps or bumps or problems. 5% of the mammograms will miss a cancer that may be detected on physical exam. So please, you must get your physical exam by the physician of the breast in addition to the mammogram. Cervical cancer is the pap smear, but you're going to get the HPV vaccine if you're between 9 and 26, regardless whether you're sexually active or not, because it helps to prevent cervical cancer, which is an STD. All right? Prostate cancer, you got to get the finger. And then you have the PSA, the prostate-specific antigen, that does help. It along with the finger, the two of them. And then screening for cancer worthwhile, yes it is. Colon cancer screening for someone at average risk, no first degree relative with colon cancer below the age of 60. You should start it at age 50 and do it every 10 years, unless you have a polyp that's precancerous and then it goes to every 3 to 5 years. Or you can do the double duo, flexible SIG and barium enema. I don't know why anybody would do this except that this may cost too much money. But if you are in that situation where you cannot do a colonoscopy every 10 years because your deductible is $4,000 and you don't have it, then you do have an option of doing a flexible sigmoidoscopy and a barium enema. That's 2 different exams, by the way, with 2 different preps of all the guts going out. So this is, I think it's cruel and unusual punishment. My husband says, keep going. All right, so that's the way we do colon cancer screening. Breast cancer, average risk. Okay, you start doing the breast exam by the doctor. This is important stuff. At 20 to 39, every 3 years. But at age 40, you are to get a yearly breast exam and mammogram. If you have a first-degree relative with breast cancer, first degree means mother or sister, not aunt, not grandma, not great-grandma. First-degree relative with breast cancer at an early age, let's say she got breast cancer at the age of 40, then the recommendation is to start 10 years before that, if that's a mother or a sister, okay? 10 years before if you've got first degree. All right, cancer, we already talked about that, cervical. Prostate, we talked about that. Improving our psychological well-being. We as Baha'is believe that this is a spiritual, a fellowship, a process in which we should involve daily through reciting prayers, through meditation of the writings, reading the sacred writings on a daily basis, meditating upon them, getting deeper understanding for ourselves so that we can convey them. It is an active thing that we must involve every day, just like we have to eat every day. I mean, you don't eat once a week and think that's going to do it. You know that you must eat every day. And then the spirituality and the growth of us is a daily thing and multiple times a day, saying our obligatory prayers. This is what we Baha'is believe that helps with this spiritual well-being. Also, don't forget, one day you do retire, and you got to plan for that. Signs of depression, serious things can happen when depression set in. And I know that many people feel, well, we just need to pray. But let me just say to you that if you have significant symptoms such as feeling of sadness, feeling of guilt, feeling of failure, weight loss, insomnia, suicidal ideation, harmful thoughts, life is just not worth it, I don't know why I'm living, I don't know why I have any strength, I have no strength, I have no motivation, I don't want to go out, I don't want to see anybody, I don't care, I don't care anymore. If that occurs, multiple of those symptoms for 2 weeks or more, okay, just not one day when you're having a bad day, for 2 weeks or more, please go and talk to your physician about depression. Most of the doctors miss this diagnosis because you come in with a headache or a backache. But a lot of depression is tied into what we call psychosomatic symptoms, which means it's a lot of aches. Advanced directives, let your doctor know about what you want to do in the case of your ill health. Everyone should have a living will. Medical power of attorney, this means let us know who you want to speak for you if you cannot speak for yourself. This tells me that maybe you can reverse age. Eleanor Roosevelt, sorry. I got this picture. This is actually a card. I thought that was absolutely phenomenal. Here is someone who definitely exercises and probably has no joints. Eleanor Roosevelt said, beautiful young people are accidents of nature. Beautiful old people are works of art. I truly believe that. So, Baha'i perspective. Let's turn our face towards God to heal the body, the mind, and the soul. According to the Baha'i teaching, the human body is a temporary purpose anyway. It's here for us to improve upon our soul and our spiritual well-being so that when we go through the other worlds of God, we might progress and we might be closer. Our body is going to be laid aside at some point. As my father said, I've never seen anyone leave alive. So, Baha'i perspective, simple obedience to the hygienic and moral commands. If you even look at Moses, Buddha, Christ, Muhammad, or Baha'u'llah, if we did this, we would do more to prevent disease than all the doctors and public health regulations. But you know what? You guys are going to keep me employed. Because people, by our nature, unfortunately, with the free choice, really don't take that to heart. They don't become the spiritual, we don't become our full potential here in this world. But we should try. We should try every day. In fact, it seems that this such obedience, good health would just be the general thing. We wouldn't be talking about all of this. And instead of being blighted by disease in either youth or infancy, we'd have people who live to 120 or over 100 pretty regularly. That's over 100 with your mind and with your quality of life. Healing is needed. Healing of just our whole nation of individuals. So Baha'u'llah, like his inspired predecessors, not only shows how health is to be maintained, but also how it is to be recovered when lost. And we believe that this is a spiritual process as well as physical, taking care of both. He comes, Baha'u'llah, as the great physician, the healer of worlds of sickness, both of body and mind. This is Baha'u'llah's tablet to a physician. It was a physician who was in the Middle East, and it was in a time when the language was a little bit different. We don't know and understand all the words, but we can understand what he's saying really applies. This is a draft. My husband promised me not to say that he did it. I had my fingers crossed when I said that. He translated it from Arabic. Some of this you've probably seen, but some of this you may not have seen. But Baha'u'llah, in Baha'u'llah's tablet to a physician, this was a specific physician who lived in this time. The ancient tongue speaketh that which will satisfy the wise in the absence of physicians. Do not eat except when hungry. Isn't that an interesting thing, how we overeat? Do not drink after retiring to sleep. Exercise is good when the stomach is empty. It strengthens the limbs, but when the stomach is full, it can be harmful. Do not neglect medical treatment when it is necessary, but leave it off when health is restored. Do not take nourishment until digestion is complete. That's basically saying don't overeat. Do not swallow until you've thoroughly chewed your food. Treat disease first by diet. If you find a single herb, don't go to compounded medicines. Abstain from drugs. Begin the meals with the mention of my name, the All-Glorious, and end with the name of the possessor of heaven and earth. That which is difficult to masticate is forbidden by the wise. And that's a hard one. But we as Baha'is can eat meat. A light meal in the morning is as a light to the body. all the medical evidence shows that you should eat breakfast, and if you're not, you are depriving yourself of nutrition, brain power, and everything else. All harmful habits. Avoid all harmful habits. They cause unhappiness in the world. Verily, the most necessary thing is contentment under all circumstances. By this one is preserved from morbid conditions and from lassitude. So you know, some people that get the diagnosis of cancer are amazing. They actually inspire me because they take it on and they say, that's okay, doctor, you say I got cancer, but you know what? I'm beating this. And I said, go on. You go head on. I believe you are. And I never give up hope, and they never give up hope. And we pray, and even if they can't get a cure, guess what? They don't give up hope. Because hope is alive. It's an important thing. So you always have to have that. Yield not to grief and sorrow, they cause the greatest misery. Jealousy consumeth the body, and anger burneth the liver. Avoid these two as you would a lion. Isn't that something? Baha'u'llah's tablet to this physician says, O physician, in treating the sick, first mention the name of God, the possessor of the day of judgment, and then use what God has destined for the healing of his creatures. By my life, the physician who hath drunk from the wine of my love, his visit is healing, and his breath is mercy and hope. Cling to him for the welfare of the constitution. He is confirmed by God in his treatment. The science of healing is the noblest of all sciences. It is indeed the most potent instrument for protection of the bodies of men by him who breatheth life into the bones. He hath given it the foremost rank among all the sciences and the pursuits of the learned. However, this is the day for these to arise to help my cause, while fully detached from all the worlds. There are noble professions in all areas. This is to a specific physician at a specific time. So I want us to understand that we must not abandon anything that we're doing that is worthwhile, because work, when done in the right spirit, is worship. But certainly as a physician, I take this to heart. And every day I do start with a prayer.